hyperlordosis when I'm doing it. I set my hand on the patient's back until I kind of get a soft bend in my elbow. So a nice and easy way to think of it is like if you're holding a cane or when you're setting a cane on someone, just where you'd set that cane. And then when I'm just going one hand on each transverse process. So I use my piezoform for a lot of my manipulations. So, and everything's going to be quite similar. I find the rib angle or just a little bump where that rib attaches and drop directly in, or the spinous process and drop directly off. And then it's all the same. It's the skin lock and extend instead of putting your pressure on two different ribs, you're putting your pressure on the same thoracic segments. And now can I have you take a deep breath in and out. 4, 5, 6. So he takes about a 6-second exhalation and just keep on breathing normally now. So when I plan on doing my quick thrust, I'm going to try and time it on 5.5 seconds, so that way I get it right at the end of his breath out. And then from there, once I have my pressure there, I'm just going to ask him, how does that feel?
Feels good.
Feels fine. And then that's when I'm going to continue to see how that mobilization's feeling. And if he starts to have more and more pain, then I'm not going to do it. I'm going to move on. But when I go to do my manip, I'll have him take a deep breath in and out. There's 2, 3, 4, 5. And there we go. I don't know. Did you feel that?
Yeah.
I got a manip there. Or I had a nice little cavitation, but I just go for that. I wait until it's right there, then I just give a little, quick, small thrust. So you don't need much. So you can just practice it even in without doing end range, just putting pressure on their back.
Are your hands on the same side of the spine or on opposite sides?
Opposite sides of the spine. Spinous process, and then one hand's on each side. Any other questions with that?